Good day, everyone. Respected judges, chairpersons, and the organizing team. Myself, Dr. Meghna Sriravali Puranapanda, postgraduate from the Department of Oral and Maxillofacial Surgery, and I sincerely hope all are safe, sound, and secure in this pandemic. Oral cancers are leading as they are sixth most frequent diseases with high mortality rate. Oral squamous cell carcinoma accounts for about 90% of these oral cancers. They are of highest healthcare burden globally. Lack of early screening methods has been highlighted as a significant challenge for the management. So, there is a need to identify and follow on early detective methods for identification of oral cancers to reduce the morbidity and mortality. One such non-invasive, simple tool is in our biological fluid, saliva. So, I hereby wish to present a paper on the topic Role of Salivary Biomarkers in Oral Cancers, a review. Worldwide, incidence of this head and neck cancer accounts for more than 6,50,000 cases. 20 per 1 lakh population are affected by oral cancer, which accounts for about 30% of all types of these cancers. In that, 41% are by the carcinomas of buccal mucosa, followed by tongue carcinomas for about 29% and retromolar area carcinomas for about 12%. 80% of these oral carcinomas are a well-differentiated histological types. Males are more predisposed for the oral carcinomas for about 77%, and in the age group of 40 to 50% there is more incidence of oral carcinomas. The major etiological factor for the diagnosis of oral cancers in the population is through smokeless tobacco, and the other risk factors or the etiological factors including smoking, high alcohol consumption, betel nut chewing, and the presence of human papillomavirus, genetic predisposition, or a poor oral hygiene or the low socioeconomic states. The various screening methods to detect these oral carcinomas involves the clinical examination, biopsies like the incisional biopsy or the fine needle biopsy, and the viral staining techniques or the radiological imaging, the computed tomography or the contrast enhanced computed tomography sections or the magnetic resonance imaging, or for the identification the metastatic tumors is the PET scans or the spectroscopy or the biomarker detections and the histological examination. The gold standard tool for the diagnosis of the oral carcinomas or any other carcinoma would be the histological analysis through the biopsy. But this biopsy is associated with an invasive procedures, complexity of technique, and the cost issues, and to the problems of low access to the hidden suspicious areas would be of faults. So, after getting diagnosed with a carcinoma, it is managed by radiotherapy, chemotherapy, or through the surgery. But the perfect prognosis is not attained due to the late stage diagnosis, which increases the mortality rate, and even the higher recurrence rates of these oral cancers further complicates these prognosis. According to the global health statistics of lip and oral cavity cancers, they reported that 1,77,000 deaths occurred per year, and there is an increase of 3,50,000 cases in 2020. And two-thirds of these oral squamous cell carcinomas are majorly reported from Asian continent. In 2012, the oral carcinoma was 12th common cancer type in Asia, but in the statistics of 2018, it increased up in the ladder to 11th position. And compared to the other carcinomas, oral carcinomas demonstrated a low 5-year survival rate, which is about 20% survival in which when diagnosed in the advanced stage, but the survival rate can be taken up to 80% when these oral carcinomas are diagnosed at an earlier stages. So, there is a need to detect the oral carcinomas at earlier stages. But generally, the detection of oral carcinomas is based on the clinical examination and histological analysis, which is only seen until unless a significant malignant change are to be established. So there comes a reliable, sensitive and specific biomarkers like saliva biomarkers, which helps to detect the carcinoma changes at an early stage. And these salivary biomarkers are non-invasive screening protocols and they are effective and sensitive. So what are actually biomarkers? Biomarker is defined as a characteristic that is measured as an indicator of normal biological process or a pathological process or response to exposure or intervention of these. Biomarkers are actually the molecular signatures which indicate the normal biological, pathological or the pharmacological responses to treatment and provide useful information for detection, diagnosis and for the prognosis in the oral and systemic diseases. So, these salivary biomarkers are taken from the biological fluid saliva, which is actually secreted from the major salivary glands like parotid, submandibular and sublingual. The average salivary flow rate will be 0.5 milliliters per minute and an average per day secretion would be 1 to 1.5 liters. And there are various functions of the saliva including the defense system, antimicrobial actions, digestion, gustation and tissue regeneration. And there are two types, stimulated and unstimulated saliva. Stimulated saliva is by the increased salivary flow by using chewing gum, citrus drops and xylocox. But for the salivary biomarkers, we generally use an unstimulated saliva which is collected through a passive manner by drooling into the receptacle under standardized conditions. The composition of unstimulated whole mouth saliva will be proteins, peptides, electrolytes, organic and inorganic salts. So there is need to consider these salivary biomarkers for the detection of oral carcinomas because their surplus pool of biomarkers and collection method is non-invasive, less complex and cost-effective than the blood and led to the proposal as a suitable biological sample. Even the saliva has an edge over other body fluids by having a low background of inhibitory substances. And these are easy to be collected, easy to be transported, and it overcomes all the cultural and religious objections. So, the early detection of salivary biomarkers is through four techniques by using a liquid biopsy technique or microarray analysis system or polymerase chain reaction or through enzyme assays. And going back in the history, even the salivary biomarkers have been used to detect the breast cancer for the first time, followed by diagnosis of ovarian and pancreatic cancers. So how this saliva helps in oral cancer detection? The saliva has a direct interaction with the cancer cells, and even the cancerous cells shed directly into the oral cavity. They also have the cancer progression and metastasis can also be identified by these biomarker identification. These oral cancer biomarkers were also divided based on the molecular state, molecular signature, and the disease state. So why we shall actually target the salivary biomarkers in the protein stages only? The proteins diversely participate in the cellular activities in comparison to the DNAs and RNAs. Therefore, proteins play an important role for being an ideal salivary biomarker specifically for the identification of the oral cancers. The various proteomic analysis of the human saliva in an unstimulated whole mouth saliva would be by mass spectrometry and shotgun proteomic approach. The biomarkers would be an increased abundance of myosin and actin and the increased levels of choline, betaine and peptidoglycan. And the protein biomarkers identified in the unstimulated whole mouth saliva would be interleukin 6, interleukin 1A, 1B, and the cancer antigen 125 with CD44 and 59 and the glutathione. These all, through the techniques of ELISA, immunoblot, and HPLC, will show the early stages of the oral cancer. And the others would be alpha-A antitrypsin and secretory leukocyte peptidase, cystatin A and keratin 36. And the salivary genomic biomarkers will be the loss of heterozygosity in the gene is an early indicator for the conversion from potentially malignant disorders like leukoplakia, erythroplakia, oral squamous cell carcinomas into oral squamous cell carcinomas, and the frequent loss of zygosities in the chromosome of 9p, 3q, 13q, which shows an early occurrence of oral carcinoma from potentially malignant disorders. And the other salivary genomic biomarkers include the histone family 3 and S100 calcium binding proteins, and the loss of heterozygosity in the combination of other biomarkers like T3S1234 and the mitochondrial DNAs. And the other method is a salivary transcriptometric biomarkers, which, as given by Lee et al., is a microarray analysis technology which is used to analyze the salivary transcriptome, which showed a significant elevation of 7 biomarkers in oral cancer patients. These are generally involving interleukin 1 beta, interleukin 8, H3 histone family, and long non-coding and MIR125A. And the other salivary metabolome profiles, they have the characterization for the relationship of these salivary enlates with the oral cancer. The biomarkers involving the alanine, serine, glutamine, choline, hydroxycarboxylic acid, and isoleucine and leucine, and the piperochloric acids and hypoxanthines. Then the other miscellaneous biomarkers in the whole saliva for the oral cancer detection involving the oxidative stress related molecules, glucocorticoids, and non-organic compounds. These are used for the recurrent oral squamous cell carcinomas. And the other than oral squamous cell carcinoma, salivary biomarkers are also used to detect the breast carcinomas and lung carcinomas with the biomarkers of CA125, profilin, haptoglobulin, and S100 calcium binding proteins. So finally, the role of the salivary biomarkers is in the detection of potentially malignant disorders, detection of oral squamous cell carcinomas, breast cancers, lung cancers, and they have a prognostic indications and reduce the morbidity and mortality, and they have early detection states to decrease the risk of the oral cancers. And there is still need to further validate, and the future work is of course necessary to have a specific and sensitive biomarkers for each and every systemic diseases, including the oral squamous cell carcinomas. And even with the presence of false positive states due to the inflammatory conditions has to be reduced when taken into consideration of the salivary biomarkers. So I hereby conclude my paper by saying a human saliva is truly a unique biofluid with a huge clinical and diagnostic potential. And the human whole mouth saliva is a non-invasive, painless, simple, and easier to administer specimen, and is expected to play a significant role to uncover the secrets of diagnosis and pathogenesis of the oral cancers. And with the advent of newer technologies, I still expect in further days a sensitive and specific biomarkers will be available to identify the oral and systemic diseases, including oral carcinomas. And I sincerely thank 4th International Salivary Summit and the organizing team for giving us this opportunity. Thank you.